Hi everybody, this is our weekly update on COVID-19 response for Richmond Community Services. It's been a very busy week, as all of these weeks been very busy for about 7, 8, 9 weeks now. But it was a good week. We had many things happen that were very positive. So we'll start off with listing all these great things that are resident related. I am very pleased to say that we don't have anybody on precautions at 919 building. Keep in mind that we have not had anybody with COVID positive results in that building for 6, 7 weeks now, but we do have people on precautions for other medical reasons, and everybody's off precautions, everybody's doing really well, and really makes everybody working for Richmond, and specifically at 919 building, pleased with the development, and we hope to keep it that way. We also have 2 cases of COVID-19 positive in our residential services in group homes, but fortunately both people are asymptomatic, so that means they don't have any symptoms of COVID-19. They're just testing positive, and they were really tested by chance, not because we suspected this result. And additionally, two people who were positive before and were hospitalized due to COVID-related issues are now testing negative, and they're doing well, and they're well on their way to recovery, and hopefully we'll be seeing them back to their homes soon. So those are, in terms of residents, the best news that we could possibly share. But we are continuing to use the same precautions and follow the same protocols that we've been following since early March, because we still want to keep everybody healthy and safe. So as a reminder to families and staff, we are going to continue using personal protective equipment, but given that we don't have at 919 anybody who is COVID positive or on precautions for that matter, we are going to only use a surgical mask and gloves. No need for N95s, no need for gowns, no need for hair covering, just a mask and either surgical or cloth mask. So we will continue only using N95 and full PPE gear on people who are on precautions. We cannot decrease our attention to this. We cannot let down our guard, because COVID-19 is still very active in Westchester, is still very active in the world, and we need to continue doing an excellent job that we've done so far. So thank you all for participating in this. Thank you all for really doing your best and keeping our residents safe and healthy. So that's resident related. Agency related, I'm very happy to say that we started a new program, emergency respite program, that we are running from our day program North. We got approved. We're one of the 3 agencies in the state of New York that provides emergency respite, and we right now have our first guest. It is really lovely to have somebody being above our offices here, to hear voices upstairs and to hear footsteps, because we really miss that. We miss not having our day programs open and our day program participants coming downstairs to bring mail or just come out and hang out with us. So it's nice to have somebody new here. It really warms up our hearts and makes everybody working here happy that we have a guest. Emergency respite is up to 14 days. And we hope that we will be able to offer these services to other families that are in need. We also had a terrific week, because we had parade. We had our Richmond parade. Senior management split into 2 groups. One group went south, one group went north, 6 cars each, and we went by all of our group homes, bringing some goodies, bringing balloons. Of course, everybody was wearing a mask. There was social distancing. We kept away from each other, but we know that we brought a lot of joy to our residents. And I have to say, very selfishly, I said this numerous times this week. This was the first time since we started this early March that I felt absolute pure joy of being out there and really having a grand time. Being able to go and see our residents and be greeted by them and make their day a little brighter. So I wanted to thank all of my senior staff for putting this together. We took some treats with us. We had balloons. We made a lot of noise. We disturbed a lot of neighbors with honking and just being out there. Many of the group homes were banging pots when we arrived. So we really made our presence known. to the neighborhood, which was great. And if this continues, we'll certainly do another parade, but I honestly hope that we will not have to do another parade and that this will end soon. But to that effect, I also wanted to let families know I do understand how difficult this is for you, and I know many of you are calling asking when the visitations will be restarted. We are not able to restart visitations yet. The ban on visitations is still in effect by OPWDD and the Department of Health, and there is not really that we can do about that. So if you want to come by and do a window visit, absolutely, we can do that. And many of the families already took us up on that offer. So please continue coordinating with group home managers. They'll be happy to assist you with that. But we cannot have a backyard visit. We cannot have a deck visit. That is just not what OPWDD allows. I do understand how difficult this is on you. I do understand how difficult this is on our residents. However, we are better healthy and safe apart than sick together. So let's just keep it up. We survived 2 months. Let's just keep going until this is over so we can continue to keep everybody healthy and safe. Additionally, I wanted to say that in all of our group homes, we are continuing the isolation of residents, basically asking everybody to stay in their rooms as much as possible. We did not restart communal dining. We did not restart any communal activities because we need to make sure that people are decreasing number of contacts that they have with each other and with staff, so we continue to keep everybody safe. So that's it for this week. It was a busy week, but it was a very, very positive week and a happy one for all of us here. I wanted to wish everybody a safe holiday and a nice weekend. And stay healthy, wash your hands, and we'll talk more next week. Thank you.